Hey, it's Chris Bowling.
Chris Fire.
Brad Johnson.
Happy Thursday, gentlemen.
Thursday, Brad.
Happy Thursday.
Thank you for once again all your hard work this month. That now we get to cherry pick out of all your wonderful topics in your bottom line newsletter. We can do a little video on them. So thanks for doing that again.
You're welcome. Thanks for having me.
What's first on the agenda?
Yeah.
So I always like big picture, right? If we understand the big picture, then the more detail becomes a little more clear. Let's talk about where Americans get their healthcare coverage, right? So we know that. What's that?
So what are my options?
So your options are group insurance,
Okay,
Medicare, Medicaid, kind of individual coverage, whether that's on the exchange or people just buy it on their own if they're self-employed. We'll call it military. That could be TRICARE, VA.
Yeah.
And I suppose uninsured, but that's not where they get their coverage. They just choose not to get it. So
Right.
all those choices, what do we think? Where do most Americans as a percentage get their coverage?
So these are all Americans, not just working Americans.
Correct. All
Yeah.
Americans.
I'm going to say probably still group though. When you think of the size of employers that are out there.
I'm going to agree, but I'm also curious to know who the second one would be as well. So let's start with the largest. It's probably group.
All right. So buyer's right. You're both right. You both guessed the same thing. So group coverage. So as a bonus to that, what percentage of the population has group coverage? If it's the number one,
I have no clue.
54.72.
I think you read
54.72.
I think Buyer cheated.
He's exactly right. The good thing is it proves to me you actually read this newsletter.
I do read the newsletter.
Man. Sorry, Brad.
And Steel Trap Buyer, just quoted the percentage, spot on. So kind of interesting though, isn't it? So over half of Americans get their coverage through work or through a spouse that works, or kids obviously through their parents that work. So that's still the predominant one. You'd asked about the second one on the list. So Medicaid/CHIP. So CHIP is the health care coverage for low-income families with kids.
Right.
That's
I would have
about
Medicare. I would have bet you $100 that it was Medicare.
Actually, I would have as well. I would have as well. CHIP Medicaid was 21% roughly, or as Chris would say, 21.1% if he's getting specific. And then Medicare's third, 18.2%.
Oh, I would have never guessed that.
Didn't we have again, years are just meshed together in my brain, but we had an increase in Medicaid eligibility with the Affordable Care Act. So that sticks in my mind that we had so many more qualifying households.
Yep, you're right. I think that pushed it over the limit, and I'd be curious to go back in time to see, because I do think Medicare was too for a while. And then fourth was non-group private health insurance. So if you're self-employed and you buy it directly from the carrier on individual or exchange, but this is kind of interesting. This is 13.7%, so 14%. So we hear it talked about a lot, but it's still not a major. Well, I mean, it's significant, but not like half.
Yeah.
But I think that's the part that's changed a lot in the past few years. That's probably why we hear about it a lot.
Well, and you just think of how many of the group plans are insuring, the 54.72% of the population. That's a lot of legislation and regulation and impact that has nothing to do with healthcare.gov. I mean, or anything else that you typically hear when governmentally they're speaking about healthcare. It's always Medicare, Medicaid, or the exchange. There's very little conversation about updates on the group side, but that is what is impacted the most when change happens.
Yeah, you're right. And then to round it out, in case you're curious, I'm just going to lump in the military. So like TRICARE and VA, it's about 5%.
Okay.
And then, the uninsured category is 8.6, and that has dropped. Don't ask me what it was, but I do know it's
still dropped. A lot though. I mean, you think about uninsured is, 70% of what, the ACA marketplace is, if not probably about the same, because we're talking individual, not just ACA plans at 13.
Yeah.
Wow.
And with the ease of now being able to qualify for Medicaid, if you're low income, or even just the subsidies, if you're just above those poverty limits, 8.6% seems high, because those folks, if they really went to pursue it, I'm convinced could find coverage. It's just choosing not to.
Yes.
So if you add all those percentages up, it's well over 100%.
Wow.
Some people have double, like they double up. So you might have military and group. You might even have Medicare to some degree.
And group. Yeah, that's a good point.
Anyhow.
So Chris, you had said you were going to, guess like 120% was on that. So I mean, truth, there is more than 100. So you weren't totally off when you said that.
Yeah.
So,
Yeah,
so a question, let's go back to that uninsured. It makes you wonder, is it better financially for that person to be uninsured getting care versus being on the exchange and getting care and having a deductible and having a coinsurance? Or do you have a better chance of that provider just simply writing off your claim because you don't have the ability?
That's a good question.
I know where I would fall. I just wouldn't want those nasty letters to come through to say they're going to, take everything away.
And then I flip that as well. You've probably got some extremely wealthy, high income individuals that may not be concerned that they're paying their way as they go because they've got the ability to self-pay. I mean, that's the other total opposite end of the spectrum for non-insured.
Right.
Yeah. 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 I don't know. I didn't, so if you're on the Medicaid side of things, basically everything's picked up in full.
Yeah.
So there's no deductible. If you're on the exchange, there's even deductible buy downs basically that you get not only tax subsidies, but benefit subsidies as well. So, gosh, to that question, if anyone's listening, they want our advice. I get the insurance versus getting the nasty notes from their collections department would be my
absolutely
advice.
No, good topic though.
Yeah.
Brad.
All right. That's what we got for today.
Well, thank you very much. Appreciate you.
See you guys.
All right. See ya.
We'll see you.